talking government procurement with a crazy bill called
Welcome back to The Big Show. I'm Bill Culhane along with Tony Callis. We're glad to have you back on The Big Bid Theory. Tony is going to recap his recent business/pleasure/fun-filled trip to the Golden State. Speaking of trips, what a whirlwind journey our little podcast has been on the past handful of episodes. We've talked, and you folks know this, we've talked about terrorism, potential shenanigans in government purchasing, procurement, and now we're going to discuss another topic that has been really hot in the news recently, and the flame's growing, by the way. A very special, passionate guest will join us to discuss, again, a topic that has many, including those in the public health universe, on alert. That'll come up later. Tony has grabbed the crazy bid baton and will recap yet another. We know this, the well is never going to run dry when it comes to governments putting out what we consider, in our humble opinion, crazy bids. Tony, we missed you. Now, understanding, of course, full well that you had to recharge the batteries, grab a little fun and sun. And I should note this for our listeners. Tony broke off his vacation to jet back here to Central Texas so that he could be a part of the little podcast. How was Cali, Tony?
To say short, it was fantastic. I traveled up and down the 1 and the Coastal Highway.
Nice.
All the way from Los Angeles down to San Diego, and got to say, it's unforgettable. It's just an amazing experience.
Yeah, nothing like California. I have kind of a connection with California. My parents, of course, I'm talking a few years ago. My parents met in Los Angeles. My dad was stationed out there. My mom was living out there. They met in California, but growing up on the East Coast, for me, California was kind of like this mystical mirage. I, of course, would see it on TV and the movies, but always wanted to get to California. And then, fast forward, I'm older than I look. I, through business dealings and those kinds of things, spent a lot of time out in California. I have a brother who's living in San Diego, an aunt living in San Diego. In short, I know some people, there are some knocks on California, but I love it. California, I guess, a lot like Texas, depending on what part of the state you're in. Obviously, different environments, different people, different cultures within the same state.
Yeah, I got to say the whole entire experience. I mean, just going past the base in Oceanside, the Marine base out there, just the cool things you see out there, from the ocean to the surfers to just the culture, the people, the restaurants, the healthy organic living, the perspective from there. It's just a very positive experience. I understand some people are indifferent about California, but I just got to say it's a wonderful place. I'd probably move there if it wasn't for the living costs.
Yeah, that's a big one, and my brother talks about that as well. And, of course, there is the traffic. I've spent a lot of time in the L.A. metro area, and, yeah, you've got to be very selective on when you're cruising around town. Now, by virtue of our day jobs and really an interest in keeping up with what's going on, Tony, our beloved production staff, have taken out our microscopes and have done some background on this Zika virus. Microscope, Zika, do you see what I did there, Tony?
Mm-hmm.
Okay. Sorry. Ba-ba-da-ba-boom. Tony, you've heard part 1 of our visit with our upcoming guest, and I'm telling you, folks, this gentleman is passionate about Zika for sure, and we'll hear in a moment, is really tuned into what's going on throughout public health, so much so that by a unanimous vote of our production staff, we will be rolling out the interview in 2 parts. So with no further ado, in this episode, we welcome in Dr. Rodney Rohde. Dr. Rohde is the Associate Dean for Research, the College of Health Professions, and Sharon Professor in Clinical Laboratory Science at Texas State University, not far from our studios. And Dr. Rohde, he's credentialed, published, is also active, obviously, in getting the word out in the media. In this case, Zika, literally just prior to our visit, Dr. Rohde completed an interview for a local newspaper and just lectured an audience of 600 people on Zika. So again, here's our visit with Dr. Rodney Rohde. Dr. Rodney Rohde, welcome to the Big Show. We are quite appreciative that you were able to carve some time out for our audience. How are things going today?
They're going great.
Very good. Well, I mentioned in the green room, the virtual green room, a moment ago, Dr. Rohde, that just today on my news feed, I saw a variety of articles. Lack of funds could stall Zika vaccine. Congress must move beyond partisan politics and act on Zika. Zika case in Texas linked to Miami travel. I saw an article, Zika symptoms and risk as 49 pregnant women are diagnosed in New York. Now, Dr. Rohde, we know this. Hillary v. Donald is mesmerizing theater for many of us. Pokemon Go, of course, it requires intense coverage. We acknowledge that's important. But for the purposes of our visit on Zika, let's kind of start with the basics, a building block approach. I've done some research. Zika is not a new kid on the global block. What are the origins of the Zika virus?
Sure. Thanks, Bill. First of all, thank you for having me on. It's always great to spread public health education. Zika virus itself was discovered actually back in the 40s, around 1947 to be exact. And its name is actually from the Zika forest, which is in Uganda. So the first human cases and things like that started popping up soon after that in places like Africa and the Pacific Islands. And it's probably, keep in mind, this has probably been circulating in different populations since then. It's just that we don't always look and we don't always know when we're not testing for it. Roughly in 2007, we had about 14 cases pop up, and then as you move along that time frame, as soon as 2014, we started seeing U.S. travelers kind of returning from some of those areas that we're hearing about now in the Americas, including Puerto Rico, the Virgin Islands, Brazil. Certainly during the Olympics, this has been on everybody's mind. So it's not uncommon in the United States. We've had recent waves with other arboviruses, which are what viruses that are transmitted from mosquitoes are known as, like chikungunya, most recently a couple of years ago, and prior to that, West Nile virus, dengue virus. So these are not, as a family, uncommon.
Most people I know, and obviously it gets a majority, at least what I've seen, it gets a majority of the publicity in terms of the media. The threat that Zika virus presents to pregnancies. But what are the other medical risks, the threats that Zika presents?
Sure. So there's certainly pregnancy and the causation and the correlation of Zika virus to fetal situations, to babies in utero. That is the primary news grabber, and with good merit for sure. But certainly there's other instances of it being linked. This is a little more rare, but it's sometimes being linked to Guillain-Barré syndrome, which is kind of a nerve issue. But in general, about 1 in 5 people will have symptoms, and so those symptoms are typically kind of flu-like. So nothing major, but certainly there are extremes, like with any virus, that we're concerned about that can cause problems. And then you also, start worrying about, and this may be a different line of questioning, but the virus getting into blood supplies and things like that. So there are issues of it being transmitted sexually through the blood supply, but the primary transmission route will always be mosquito bites.
So that's a good segue, Dr. Rohde. What are the testing processes, methods for Zika? And I mentioned again in the virtual green room, I've seen a lot of activity in terms of what's going on as far as a vaccine for Zika. So again, what are the testing processes, and what, if anything, is the latest you've heard on a vaccine?
Well, with respect to, let me back up when you talked about testing, and then I'll come back to the vaccine if that's okay.
Sure.
The testing is actually, it's pretty straightforward for those of us who are in kind of the medical laboratory and public health environment, because we have been through these types of concerns before with things like West Nile and even Ebola a year or so ago. So just generally what happens, most of the time when a person is suspected of this viral infection, first of all, they have to be tested and confirmed through a laboratory test. That's really not what you think about when you see it in the news, when they're reporting, 4,000 to 5,000 cases of Zika in a certain area of the world. Most of the time, that is based on symptoms and a physician or others kind of making a very educated guess. But to truly confirm it, it does require a specialized lab test. Typically, you're looking at blood and or urine as the primary specimens that are being tested. You can look at some other things like tissues and things like that, but typically blood and urine. And just to keep it general here, usually you're doing either a serological test, which is looking for specific types of antibodies that the human will produce in response to that infection. You may also look at actual viral proteins or antigens that can be picked up in an immunoassay. Those are usually kind of the screening tests, so you're kind of using a shotgun, if you will, to kind of see what's happening. And then you can come back and use a very specific, complex molecular test. These are typically called quantitative polymerase chain reaction test or other types of molecular tests. And that allows you to truly genotype, which lets you know what type of Zika virus variant it is, because sometimes they're different in different parts of the world. And people like me and epidemiologists and physicians sometimes kind of like to know what's circulating around the globe. So the testing is very important, and I do like to make that point because the general public doesn't realize sometimes how important that is, from the type of specimen you're giving to the professional that's running those tests in the medical laboratories and in the public health laboratories. These are not tests that happen on the spur of the moment with a physician or a nurse. They're a full professional kind of backbone to our public health and medical laboratory setting and healthcare that does those tests.
Let me just jump in, Dr.
Sure.
Ray, if I could a second. What's the turnaround time on those tests? Now, I understand there's probably situations where a sample would be expedited, but in general, you present to a physician or some kind of clinical setting, you're ordered to have a test. Well, what's the turnaround time? That's
a great question. It's a little nuanced as all things, but I'll give you the quick answer.
Sure.
The quick answer is that you can screen for this virus with a very somewhat rapid immunoassay. That's where you're looking at blood and serum, and you're just looking for antibodies and or viral protein. That you can usually do in a few hours or less. When you go into the more complex confirmatory molecular testing, and again, this is where you're looking at genetic material, so RNA for this particular virus, that can take 24 hours or longer, depending on, again, expediting the sample. Certainly, if it's really, really high-level importance, for instance, I'm sure the first index case of an infant in Texas and things like that, they were rushed to the public health lab in Austin and are probably split and sent to CDC so that they could get that confirmed as soon as possible. And that's typical in most things, same as Ebola, same as other types of outbreaks where they're really going to rush through orders. But in general, it'll take a little bit of time to get that done.
Understand. And so, again, what have you heard in regards to a vaccine? Any progress?
Yeah, I probably have seen the same things that most general public people see in the regular press, but I do follow peer-reviewed journals and things like that and some of the backlog of literature. And there are some specific groups that are making good progress with vaccines. The general protocols for these, and again, this is kind of general, but they start off using different combinations to make sure they cover Zika viral types, because sometimes you have different types. Much like our flu vaccines will have 3 or 4 different protective components. So they make sure they kind of have that set up, and then they're also looking at getting that put through usually an animal system, so primates or something like that will be the first kind of wave, and then eventually it'll go into clinical trials. So like I've told other people that ask this question, including my own students, it's you see in the news these great kind of stories, and it is great. They're making progress. They're finding protection for some of these experimental vaccines, but it'll be a while. Vaccines never come out within a year or anything like that. So I would imagine to get clinical trials conducted, that being if they actually get one that they can get to that point, then it has to go through FDA approval and things like that. So it could be a year or more, and I would say probably more in reality before you get those totally approved.
So time is certainly not on our side right now. And Dr.
It really isn't. It really isn't, and this is just a general kind of thing to mention about vaccines. There are, and I can't name all the groups, but there's always different groups working on, the latest issue around an outbreak or something like that, as well as more chronic things that we're all aware of. So there's still groups working on things like, they're looking at Ebola, which has kind of fallen a little bit off the radar in the U.S., and they're looking at other kind of things you may know about, like tuberculosis and things like that. It just takes some time because we have such stringent standards on safety, which is very important, obviously, but it does take time to kind of run that through the different agencies and the different approval processes to make that happen.
And I also am aware in my line of work how funding can be an issue as well. A moment ago, Dr. Rohde, you used the word progress, and in pre-production, you and I were, of course, trading a number of emails, and I kind of gave an overview of what we do here. In the past year, 365 days, we've identified 51 51 government solicitations for equipment, services, and or solutions related specifically to Zika, meaning Zika was contained somewhere within the solicitation. And I'm talking about requests for reagents, prevention kits, medical supplies, lab supplies. There was even a request for a Zika prevention video coming out of Virginia. If you want to include mosquito control, since of course mosquitoes, they're a player here, well, there were 178 of those types of requests to date. Dr. Rohde, what is your opinion on the current government response? And I guess as an obvious transition from that, what in your opinion should governments be doing?
That is a great question, Bill.
Right, we could take hours, I'm sure.
Right, absolutely. And so, pardon me, I may get on a soapbox here a little bit, but I think many of my colleagues that work in public health would at least agree with me on most of these points that I'm going to make. First of all, it doesn't surprise me, I guess, that over 100, or depending on how you look at that, request for different types of funding avenues and streams, whether it's consumables, reagents, prevention, vaccine discovery, mosquito elimination, just all of those, each in their own way and each in their own way really important. Prior to academia, I was about a 10-year public health microbiologist and zoonosis control epidemiologist, so I've worked in this realm before outside of academia. And really what's frustrating is that from the standpoint of what's happening right now is that certainly you can see a little bit of political football going on between the executive branch and Congress and trying to get funding released to places that truly need it. I will say that this is something I've observed over 2 decades. Typically what happens is, and I don't know if it's just a United States issue, but we tend to be very knee-jerk reactionary to the latest outbreak. So we will try to throw money at a problem when it arrives, whether it's Ebola, West Nile, even HIV back in the day. And that's important. You know, when you ramp up, sometimes you need money, right? I mean, you just need money and funding to make things happen. I think what's frustrating for someone like me and other colleagues is that in reality, if we had more dedicated, ongoing, kind of eternal public health funding, and I'm not just talking about for vaccines, I'm talking about for infrastructure around when threats like this happen, so that we have supplies ready. We have something that many people don't know in the general public is the actual healthcare professionals, the epidemiologists, the medical lab professionals like myself, public health laboratorians. Those FTEs have fallen off over the last 2 decades. So you get to the point where the public screams about why aren't you doing something, but in reality, throwing money at Ebola or Zika after it's on our shores is problematic. You can't train an individual to run complex medical laboratory tests in a week. It takes 2 years for us to produce a graduate who then needs experience in the trenches. So it's a very deep problem, and like many things, it's complex because we have to use our money wisely in our country and elsewhere. But public health, whether it's education or actual infrastructure, in my opinion, is something that should be dedicated funding and should not be tampered with.
Tony, as I began my conversation with Dr. Rohde, and of course we had pre-production communication, trading emails and those kinds of things to line up the visit, and Zika was the topic. But as I got into it, I quickly realized that asking a guy like Dr. Rohde about the Zika virus is kind of like walking into Baskin Robbins and going up to somebody at the counter and saying, tell me about the chocolate ice cream. Mm-hmm. When, they're obviously Baskin Robbins, maybe not the best analogy, Baskin Robbins with their variety of flavors. By the way, they are not a sponsor yet. Well, it evolved from Zika into really questions about awareness, priorities, and public health overall. I thought, I'm biased, I thought it was a really good visit.
Oh, most definitely. And on my trip to California, I will say this, all over the airports, there's huge warning signs regarding Zika. So it's definitely one of the hottest topics right now.
Yeah, no doubt about it. As a matter of fact, I was listening to a sports talk radio show yesterday on my way into our palatial studios, and the 2 sports guys were talking about Zika virus. Now, next week, meaning next episode, Dr. Rohde and I will expand on the conversation to include, I ask him the simple question, is Zika a threat? Because sometimes, Tony, this, things can get overblown.
most definitely, especially with the media.
Especially with the media. Dr. Rohde is also going to reveal what concerns him the most. As I put it, keeps him awake at night when it comes to public health. Yikes. Wait till you hear what he has to say. By the way, do yourself a favor and follow Dr. Rohde on Twitter at Rodney Rohde, RODNEYROHDE. Friends, next week, part 2. Do not miss it. Okay, Tony Callis, new business development guru by day, surveyor of all things crazy bids by night. Well, Tony does other things as well, to be fair. But, Tony, as far as crazy bids, what have you and our crack staff discovered?
Well, the tech team actually brought something up to me. It was regarding a Hillary Clinton magazine bid for ammunition. I was like, wow, that's very interesting. It's sort of ironic and just an interesting bid, honestly. There was very little detail involving it, but that was the most I got from that bid information.
Yeah, well, the election is right around the corner, and it's Tony and I, and you go back to our original co-host, Jim Ward. Don't try to get too political here during the podcast. Well, that's going to do it for this episode. Much appreciation again to Dr. Rohde. Dr. Rohde is back next time. Tony and I will be parked here in front of the microphones. Thanks to you folks for downloading, sharing, and following TBBT. Tony, your final words of wisdom for our esteemed listeners.
I know we're all busy in the daily grind, but definitely make time for family and take that time to get out there and take some personal time for yourself. It's very refreshing and it's worth it. It's well worth the time spent. That's my words of advice.
I was going to say, partner, nice tan.
Thank you.
My email address is bculhane@bidprime.com. You can contact Tony at tcallis, TKALLAS @bidprime.com. At The Big Bit Theory is our Twitter handle. And, of course, we thank you for following us, clicking like, and or retweeting. The real question is for next time, can we get to 4,500 followers by the next show? Let's make it happen. My very own Twitter handle is contract_Hunter. Tony is at Anthony Callis. By the way, I want to know how Dr. Rohde and Tony got to use their names as their Twitter handles. I am very jealous. We're on Facebook, and we'll continue to grow there. Please help us by giving us a Facebook like. On behalf of the TBBT staff, who is now stalking Tony to pay for their trips to California, until next time, go Gunners, Barracudas, Tigers, Bobcats, and Cubs, and we wish you all the best in growing your business.
Talking government procurement with a crazy bill thrown in. The big bit theory.